So then to cap everything off is red team. It's your third year, which really kind of draws in everything you've learned at that point as a resident. As you probably hear in other videos, we are the trauma captains or kind of the trauma team. So any trauma that comes into the hospital, you as the red team respond to that, and you alternate being a captain with the trauma colleagues. And then you balance that with also running all of your medical patients. So it really kind of takes all your skills you've learned from your green, your blue, all your off service, and by the time you're a third year, you know most people in the hospital, so then really you're very adept to take care of all these patients together. So you can have a trauma followed by a STEMI, trauma, stroke. So your critical care is really high, and you're also running your team, which is the same size as your blue team. So it is challenging. There's days that are super challenging, but you're a better doctor and resident for it. And then the other side that you also get to add in there is you constantly have learners with you, which is great. So you have a rotating intern with you, and then you also have medical students with you, and so you staff those patients, which is a new thing, and you kind of start that in your blue shifts as a second year, but really as a third year you take ownership of your team, and you're coordinating everyone to take care of your very busy team. But really it's a great way to take all your skills from everything you've learned, and it makes your final year very productive, and so you feel very confident moving out to your job.
Good. No, I like Red Team. I like working with our senior residents. I think the thing that I think about the most when I think about our senior residents is I watch them run traumas, and obviously they get to be the trauma captain where they kind of run the entire scenario. Everyone's quiet. They're kind of in charge of the care of the patient in kind of an ABC format. And it really translates well then to medical resuscitation. And so I kind of picture our third years as basically trauma captains for the whole year, where they just run every case as if they're the physician in charge. They have a clear plan of attack, whether the patient's critically ill or not ill at all. So trauma patients come in both varieties: people who are almost dead, and people who thought they were injured and are not injured at all. So I think it pays out well as far as the way they then manage other patients, and I think they get seen more clearly as like the team leader, which really pays off when they go into the community and they have to work with a huge collaborative team, and they're used to being in that role. So it's not unusual to talk to a pharmacist, a respiratory therapist, nurses, because they've been in that role, in that position many times before. So.